I'm Ella Arensman. I'm Professor of Public Mental Health with the School of Public Health, University College Cork, and I'm also Chief Scientist with the National Suicide Research Foundation Ireland. In 2019, my colleagues and I were successful in being awarded a large-scale EU Horizon 2020 grant, an application that was submitted under the health program with a particular focus on the call mental health in the workplace. We refer to this new project as MENTOP, Mental Health Promotion and Intervention in Occupational Settings. And this is a very large-scale project, including 13 European countries, but also Australia. There are a number of unique elements of MENTOP, and one is that we focus particularly on sectors where we have seen high levels of mental health issues and also suicidal behavior, such as construction, the health sector, but also the ICT sector. In addition, we focus very specifically on small and medium enterprises, SMEs, because overall they do have very limited resources and supports when it comes to health and safety, but also for mental health supports and resources. There are a number of unique elements of MENTOP, and one is that we specifically distinguish between intervening in relation to mild to moderate mental health issues, mild to moderate depression and anxiety. But on the other hand, we also have developed resources for more severe clinical disorders, severe depression and severe anxiety. Another unique element of MENTOP is that we don't only focus on employees, but we also focus on health and safety officers, supervisors and managers. So we would like to focus on all important levels in an organization. Why did I apply in 2018 when the whole process started? So over many years, my colleagues and I have been working in the area of mental health and have applied to many different grants at EU level, going back as far as FP6, FP7, but also under the DJ Senko program. And in addition, with my colleagues in the European Alliance Against Depression, EAD, we have been successful in multiple grant applications over many years. And in this, we have also built very close links with colleagues in EAD in different relevant disciplines for these types of mental health applications. In addition, then, for this particular call, we had clear evidence that there were high levels of suicide and other mental health issues, particularly for the sectors in the work sectors in construction, health and ICT. So we felt that there was an urgency to start applying under this EU call. So this represented an important motivation for us to apply. Now, the specific health call in 2018 and 2019 was a two-stage process. So we first had the preparation of a number of months working towards an expression of interest, which was still very significant. And I would always be in favor of this two-stage process because the advantage is that even though it's an important investment, after a few months, you know whether you can go through or not through the next phase, but also you have an opportunity to receive helpful feedback with which you can then improve the application for the second stage, the final stage. Another important positive experience has been to work with a project management company. This has been very beneficial in terms of assistance, but also speeding up the work in terms of preparing such a large-scale application. So ideally, with a project management company, they will take care of a lot of the administrative aspects, but also planning. So you as a researcher can focus very specifically on the scientific content and also issues that relate to excellence. So what do we hope to achieve with this important project, the MENTOP project? We hope to achieve a greater insight into mental health promotion programs, its implementations, but also its effectiveness in relation to SMEs in these different work sectors. But overall, I also very much hope that the Mentop project will make a significant contribution to reducing stigma relating to mental health, and then particularly in the workplace. In many countries where we're working with the Mentop project, there are still high levels of stigma, which do prevent employees and others in a company to seek help in a timely manner. So we very much hope that with Mentop, we can make a difference.